This role play exercise is for my health policy class through the University of Texas at Arlington. Good evening, Mr. Jones.
Hello.
I'm Jane Doe. I'm an emergency room nurse in Houston, Texas. Hoping I could have 3 minutes of your time to discuss the HR 6138 bill regarding eradicating HIV and AIDS globally.
Absolutely.
Thank you. As a representative yourself for the Office of the U.S. Global AIDS Coordination and a key planner for the U.S. President's Emergency Plan for AIDS, you well know the extent of the global crisis and the importance of taking action to eradicate this epidemic of HIV and AIDS. AIDS alone has claimed the lives of 25 million infected people. In 1990, 8 million people around the world were living with HIV, but by the end of 2010, this number climbed to an estimated 34 million. This number alone speaks to the importance of the government action in fighting this epidemic. The Centers for Disease Control and Prevention estimated 21% of the 1 million infected individuals in the United States alone do not even know that they have AIDS. So HR 6138 proposes to obtain additional funding for the AIDS Drug Assistance Program and their treatments, to enhance the national HIV surveillance system, and implement evidence-based strategies for improving appropriate care for these patients. We need to ensure HIV is identified and promote compliance with management plans for these individuals. The HR Bill 6138 will also improve enrollment and retention in care for antiretroviral adherence for persons with HIV, while focusing on healthcare professionals treating individuals with HIV and AIDS through provider loan repayment programs. Other objectives of the bill include reducing new HIV infections among IV drug users, expanding comprehensive sexual health education programs, and eliminating the abstinence-only education programs. So with nearly 50,000 newly infected people each year in the United States, HIV and AIDS prevention, treatment, and care remain a challenge in policy. The CDC actually recommends behavioral interventions, testing, and linkage to the care and treatment, and I believe HR Bill 6138 can achieve this goal. Mr. Jones, I'm asking for your support and the support of the Office of the U.S. Global AIDS Organization for HR Bill 6138. I put together a brief for you to refer back to this information that we've discussed today that you can also distribute to your cohorts. I can contact you with any progression that the bill makes through the House of Representatives, and additionally I've left my contact information, and this is my business card, in case you need to reach me for any future needs regarding HR 6138. Mr. Jones, do you have any questions at this time regarding the bill or its content or expected outcomes?
Not at this time. Here's my card as well.
Thank you. I appreciate that. I appreciate your consideration, and thanks again for your time and attention to this matter.
You're welcome.